The reason for the lip being done at 3 months is so that parent and child bond better. They ask, why don't you do it earlier then? Why don't you do it as soon as the baby is born? So that, they're cuter and, the mother will bond with them better. But if you do it too early, at the very young stage, the baby have a lot of problems, especially with the anesthetic. And you can't do it without an anesthetic. So that's why you wait to 3 months. That's just about the minimum. When the child is big enough, can tolerate the general anesthetic, safe. In terms of the palate, you want, again, for the child to be as big as possible because everything is very small, you must remember. For the palate, the reason why we wait till about 9 months is for the child to be as big as possible so that everything is bigger and the child can tolerate the operation better. You want to do it between 9 months to about a year because you want to do it before the child starts to talk. Because in the cleft palate, the muscles that affect your speech, the ones that control your soft palate, is in the wrong place. So what we need to do is dissect it out and put it in the correct place so that your soft palate moves so that they don't have hyponasal speech. Okay? In terms of if you do it later, if you don't do the palate early, not only does food regurgitate and come out through the nose, which is not very comfortable, but also they get this hyponasal speech, right? If you leave it till very late, they learn to use their muscles in the wrong way, and when you come back to do it at a later date, it is harder to unlearn what they have already learned, the mechanism to, I suppose, compensate for the hyponasal speech. So if, let's say, we go to Sabah and operate on a cleft palate patient who is now 20 years old, who never got the opportunity to have the operation done when they were 1 year old, and we repair the palate. Yes, we stop food coming up their nose, but their speech will never be correct. Will never. Okay? They can slightly better, less air loss, less nasal, but they will never have it right ever again.